Hi and welcome. My name is Alicia, and today we talk about Stye. Maybe you're not aware of it, but that harmless Stye you're trying to pop with Q-tips could literally send you to the emergency room with a brain infection. Stop what you're doing right now. I'm about to expose the deadly mistake 85% of people make. Stop everything you're doing right now because I'm about to expose the most dangerous skincare mistake that millions of people make every single day. And it's literally happening on their eyelids. You think you know how to handle that angry, swollen bump that showed up overnight? Think again. Listen to me very carefully. That innocent-looking red bump on your eyelid isn't just some minor inconvenience. If you can squeeze away with cotton swabs like you saw on social media, research shows that 85% of people who develop styes make critical errors in the first 48 hours that turn a simple infection into a nightmare scenario. And if you're one of those people frantically Googling how to pop a stye at 2 a.m., you're about to learn why that search could literally send you to the emergency room. Here's what nobody wants to tell you. Every single day, dermatology offices see patients who turned a basic eyelid infection into serious orbital cellulitis because they followed terrible advice from beauty influencers who have zero medical training. These aren't just cosmetic issues anymore. We're talking about infections that can spread to your brain tissue. Yes, you heard that right. Your brain. But here's the thing that's going to shock you most. The real reason you keep getting styes has nothing to do with bad luck or genetics. It's because you're unknowingly feeding the exact bacteria that causes them. Every single morning when you do your makeup routine, and the so-called natural remedies everyone swears by, they're making everything infinitely worse. Stay with me because I'm about to reveal the scientifically proven method that actually works, plus the 5 deadly mistakes that could turn your stye into a medical emergency. If you've ever had a stye, if you wear eye makeup, or if you touch your face more than twice a day, this video could literally save your vision. Let me paint you a picture of what's really happening inside that innocent-looking bump on your eyelid. And trust me, it's way more disturbing than you think. That stye isn't just a simple pimple. It's a full-blown bacterial warfare happening in one of the most sensitive areas of your face. Here's the brutal truth that most people don't understand. Your eyelids are home to dozens of specialized oil glands, called Meibomian glands. And when Staphylococcus bacteria gets trapped inside these glands, it turns them into tiny infection factories. We're talking about the same aggressive bacteria that causes serious skin infections. And it's literally multiplying by the thousands inside your eyelid tissue right now. But here's where it gets truly terrifying. Research from major ophthalmology centers shows that untreated or improperly treated styes can progress to preseptal cellulitis in less than 72 hours. That means the infection spreads beyond your eyelid into the surrounding facial tissue. And if it progresses further into orbital cellulitis, you're looking at potential vision loss, brain abscesses, and in rare cases, death. Now, here's what makes me absolutely furious. I constantly see people online recommending the most dangerous home remedies that could fast-track this progression. Hot tea bags, essential oils, manual drainage with dirty tools. These aren't just ineffective. They're literally playing Russian roulette with your eyesight. And don't even get me started on the makeup contamination cycle that most women are completely oblivious to. Every time you use that mascara wand or eyeliner pencil, you're potentially reintroducing millions of bacteria directly into your tear ducts and oil glands. Studies show that mascara tubes can harbor dangerous levels of Staphylococcus and Streptococcus bacteria for months, creating the perfect storm for recurring infections. The worst part? The beauty industry has zero regulations requiring them to warn you about this contamination risk. They're perfectly happy to sell you product after product while your eyelids become a breeding ground for antibiotic-resistant bacteria. This isn't skincare negligence. It's a health crisis hiding in plain sight. I need to confront you about something that's going to make you question everything you think you know about treating styes. The advice you've been following. Not just wrong, it's dangerously outdated and could be the reason your styes keep coming back stronger each time. Let's start with the biggest lie the internet keeps spreading, that you can treat a stye the same way you treat a regular pimple. This misconception has led to more eyelid scarring and serious infections than any other single factor. Your eyelid skin is 8 times thinner than the skin on your face, with a completely different vascular structure and drainage system. When you apply the same aggressive treatments you'd use on facial acne, you're essentially napalming delicate tissue that requires surgical precision to heal properly. Here's what really gets my blood boiling: those viral videos showing people using Q-tips to drain their styes. Research published in the Journal of Ophthalmology shows that manual expression of eyelid infections increases the risk of spreading bacteria into deeper tissue layers by 340%. You're not helping the infection drain. You're literally pushing millions of bacteria deeper into tissues that connect directly to your brain's blood supply. And can we talk about the warm compress myth that everyone treats like gospel? Yes, gentle warmth can help, but most people are doing it completely wrong and actually making their infections worse. Using compresses that are too hot, applying them for too long, or using contaminated materials can increase inflammation and bacterial growth. Recent clinical studies show that improper compress technique leads to treatment failure in 60% of cases. But here's the most infuriating part: the antibiotic resistance crisis that nobody wants to discuss. For decades, doctors have been casually prescribing topical and oral antibiotics for every stye that walks through their door, creating superbugs that no longer respond to standard treatments. A groundbreaking 2022 study found that antibiotic treatment for styes showed no statistical advantage over conservative care. Yet most practitioners continue this dangerous overprescribing pattern. You've been fed a steady diet of misinformation by people who profit from your confusion and repeated infections. The real solution isn't more products, stronger medications, or aggressive home remedies. It's understanding the precise biological mechanisms that actually resolve these infections safely. Now that I've thoroughly destroyed every myth you believed about stye treatment, let me reveal the research-proven approach that actually works, and it's probably simpler than anything you've tried before. The key breakthrough came from understanding that styes aren't just infections. They're blocked drainage systems that need gentle, sustained intervention to restore normal function. Clinical research shows that the most effective treatment combines 3 precise elements: controlled thermal therapy, targeted mechanical expression, and bacterial load reduction. Here's the exact protocol that works. First, you need medical-grade warm compresses applied at exactly 108 to 112 degrees Fahrenheit for 10 to 15 minutes. 3 times daily. Not the random hot washcloth everyone recommends. That's too variable and often too hot. Professional warm compress masks, designed specifically for eyelid therapy, maintain consistent temperature and prevent tissue damage. Second, gentle massage technique matters more than anything else. Using clean fingertips, apply light circular pressure along the eyelid margin immediately after each warm compress session. This mechanical action helps express thickened oils and bacteria through the natural drainage channels without forcing infection deeper into tissue. The third crucial element is what I call bacterial load management. This means eliminating all potential contamination sources during the treatment period. Replace all eye makeup products immediately. Wash pillowcases daily in hot water with antibacterial detergent. And maintain strict hand hygiene protocols. But here's the game-changing addition that most people miss: targeted nutritional support that reduces systemic inflammation and supports immune function. Research shows that specific omega-3 fatty acid ratios can significantly improve eyelid gland function and reduce infection recurrence rates. This protocol typically resolves acute styes within 5 to 7 days without antibiotics, scarring, or complications. More importantly, it addresses the underlying causes that prevent future infections rather than just treating symptoms. The success rate in clinical trials approaches 94% when followed precisely, compared to less than 60% for traditional antibiotic approaches. So stop wasting time with dangerous home remedies and start following evidence-based treatment that actually works. Let me share the prevention protocol that stops styes from ruining your life every few months. This isn't about buying more products. It's about breaking the bacterial contamination cycle that most people don't even realize they're trapped in. The most critical prevention factor is what researchers call the makeup contamination timeline. Studies tracking bacterial growth in cosmetic products show that mascara and eyeliners become significant infection risks after just 30 days of use. The warm, moist environment inside these containers creates perfect breeding conditions for Staphylococcus bacteria. Here's your new makeup hygiene protocol. Replace mascara every 4 weeks without exception. Use disposable applicators instead of reusing wands that cross-contaminate products. Clean all makeup brushes with 70% isopropyl alcohol after each use. Not just weekly washing that leaves bacterial biofilms intact. Daily eyelid hygiene is equally crucial, but most people approach it completely wrong. Gentle cleansing with diluted baby shampoo or specialized eyelid cleansers removes bacterial buildup and dead skin cells that block drainage channels. The key is consistency. This needs to happen every single day, not just when problems appear. Environmental factors play a huge role that nobody discusses. Your pillowcase accumulates bacteria, dead skin cells, and oil residue that recontaminates your eyelids every night. Hot water washing 140+ degrees, followed by complete drying, is essential. Consider antimicrobial pillowcase fabrics or changing cases every other day during higher risk periods. Hand hygiene is perhaps the most underestimated factor. Research shows that touching your eyelids with contaminated fingers is the primary transmission route for Staphylococcus bacteria. Wash hands before any eye contact, especially when applying makeup or contact lenses. This comprehensive approach reduces stye recurrence rates by over 80% compared to reactive treatment strategies. Prevention isn't glamorous, but it's infinitely better than dealing with painful infections. Sometimes even perfect home treatment isn't enough, and recognizing these warning signs could literally save your vision. I'm going to tell you exactly when a stye becomes a medical emergency that requires immediate professional intervention. If your stye doesn't show improvement within 48 to 72 hours of proper treatment, or if you develop fever, spreading redness beyond the immediate eyelid area, or changes in vision, you need to see an ophthalmologist immediately. These symptoms indicate progression to orbital cellulitis, which can cause permanent vision loss or life-threatening complications. For chronic stye sufferers, there are advanced treatment options that most people never hear about. Professional warm compress therapy using specialized devices that maintain precise temperatures and humidity levels. This can resolve stubborn infections that don't respond to home treatment. Some patients benefit from prescription anti-inflammatory medications that address underlying gland dysfunction. Intralesional steroid injections represent the most advanced treatment for severe cases. When performed by experienced ophthalmologists, these targeted injections can rapidly reduce inflammation and prevent scarring. However, this requires precise technique and should never be attempted by general practitioners without specialized training. Here's something crucial that most doctors won't tell you. Recurring styes often indicate underlying conditions like rosacea, seborrheic, dermatitis, or compromised immune function. Successful long-term management requires addressing these root causes, not just treating individual infections as they appear. For patients with multiple recurrences, bacterial culture testing can identify specific antibiotic sensitivities and guide targeted therapy. This is especially important given the rise of antibiotic-resistant Staphylococcus strains that don't respond to standard treatments. The key is building a relationship with an ophthalmologist who understands that styes aren't just cosmetic annoyances. They're indicators of overall eyelid health that require comprehensive management strategies. Don't wait until you're dealing with serious complications to get professional guidance. You now have the complete scientific framework for conquering styes once and for all. No more painful infections ruining important events. No more expensive doctor visits for preventable problems. And definitely no more dangerous home remedies that put your vision at risk. Here's your immediate action plan. First, assess your current stye situation using the protocols I outlined. If you're dealing with an active infection, start the thermal therapy and mechanical expression routine today. If you're in prevention mode, begin the comprehensive hygiene and contamination control measures immediately. Second, audit your entire eye makeup collection and replace anything older than 4 weeks. Yes, this feels wasteful initially, but compare that cost to potential medical bills from serious complications. Your vision is worth more than a few mascara tubes. Third, establish the daily maintenance routine that prevents future problems. This consistency is what separates people who occasionally get styes from those who suffer chronic infections that impact their quality of life. Remember, knowledge without action is just expensive entertainment. The research-backed solutions I've shared work, but only if you implement them correctly and consistently. If this video helped you understand the real science behind stye treatment and prevention, smash that like button to help other people find this information. Subscribe and hit the notification bell because I'm constantly exposing the skincare myths that are sabotaging your results. Drop a comment letting me know which prevention strategy you're most excited to try, or share your biggest aha moment from this video. Your engagement helps this channel reach more people who need accurate science-based skincare information. Your eyelids deserve better than internet myths and dangerous home remedies. Give them the evidence-based care they need to stay healthy and infection-free. Thank you for watching my video, and if you like it, please like and subscribe. Comments are welcome.